A warm welcome back on the AM show. I'm welcoming you back, but the issue we're about to discuss is not one that gives us any comfort. The Ghana AIDS Commission is concerned about low condom use and a growing HIV infection rate, as Ghana records 17,774 new infections, and this was last year, and 12,480 related deaths. That is staggering. It's worrisome. But the question is, what are the triggers and how do we stem the tide of same? We're delving into this issue this morning with our guest. He is head of the Director General of the Ghana AIDS Commission, Dr. Treme Etiahene. He joins the conversation. Doc, good morning.
Good morning.
Last time we spoke was some months ago.
Yeah.
And you had a lot to say, and today we have another conversation. There's so much to talk about. But before we get there, I want you to follow me on some of these slides, and just to paint a picture of what exactly is happening as far as this AIDS situation is concerned. If the slides are ready, we'll just get to them before we get into it. Right. So let's get into the slides now. So there you have it. HIV prevalence in Ghana. People living with HIV, 334,095. That is people living with HIV in 2023. Next slide. So we get there. The new infections in 2023 alone, 17,774 people. That is almost 20,000 added on. And those are some of the details we'd like to share with you today. And that is from the Ghana AIDS Commission. Now, if you look at the gender of new infections, of course, we must look at the male-female ratio. 6,457. That is the add-ons in 2023, the new infections. And the females, 11,317. In fact, it is almost twice the rate of male infections. And I'm going to be asking Doc about why that is. 6,457 versus 11,317. Then if you look at the age groupings, it becomes even more worrisome. Those under 15 in the new infections, 1,698. Under 15. 10 to 19 years, 1,520. And then if you look at those above 15, 16,076. There's a story there, and we'll be painting that story when we come into the studio. But again, Dr. Etiahene, who's sitting here, he says the data indicates that Ghana has not been able to achieve its annual target of a 17% reduction in new HIV infections in the last 10 years. For 10 years now, we've not been able to achieve that. And that is Dr. Treme saying it. He's in the studio with me this morning. Then again, per the AIDS Commission, there's been a 9% increment in HIV in the population between 2013 and 2023. That is almost 1/10, right? That is almost 10%. And that is not good for a country that wants to bring HIV down to the barest minimum. In terms of deaths, like I mentioned earlier, 12,480 have succumbed to HIV, and this was just in 2023, just last year alone. We're not adding other years, just last year. And that is the tale of the tape. So let's come into the studio now. Dr. Etiahene, good to have you.
Thank you for having me.
Looking at these figures that you've just, we've walked through, what picture does it paint in terms of Ghana's HIV status and how well we are doing in tackling the disease?
Well, as a country, we've set ourselves certain targets which will help us measure progress towards ending AIDS by the year 2030 and achieving epidemic control. Now, these data show that we are way behind, far, far away behind.
How far behind, if you could estimate?
For example, new infections. We are supposed to reduce new infections by 17% every year. And that cumulatively would ensure that we achieve 85% reduction in new infections by the end of 2025. But over the last 10 years, that is 2013 to 2023, we are only able to achieve 14% reduction in new infections compared to 85% that we should achieve by the end of 2025. So you see the wide gap. In the same way, the AIDS deaths must also be reduced by 85% by the end of 2025. And over the same period of 10 years, we've been able to do only 20,000. So we have about 65 percentage point difference. And that means we are far, far away from our target. And that is the most concerning aspect, because we know that we have the right strategies, the right policies, we have the tools to really end AIDS within this decade. And so if we are lagging behind, it must be concerning for everybody. And we are lagging behind for 2-3 reasons.
What are they?
Number one is that Ghanaians are not taking HIV seriously. We are too complacent, and we demonstrate, utter disrespect for the prevention protocols. That's number one. Number two is stigma and discrimination. We still are having high levels of unaccepting attitudes towards persons living with HIV in the country. Ghana Statistical Service says that the recent report indicates that 78% of women and 72% of men, demonstrate unaccepting attitudes towards people living with HIV, to the extent that...
So stigmatization.
Stigmatization. Somebody will not buy food from a person living with HIV. Somebody wouldn't want his or her child to sit in the same classroom with another person or a child who is HIV positive or comes from HIV-affected household.
We've come very far, but it's also because of the miseducation. Do you remember back then there were claims about, someone has cut himself or herself and put it in some food and all of that? People don't even realize that the virus, until it's in your body, is very susceptible, and that even at a certain level of heat, which you would cook at, it would not survive and all of that. So then it tells me, before you go on to the other forms of stigma, it tells me that the education, while we've come a long way from the 80s and 90s when this started, look at Magic Johnson and his story. It also tells you that still miseducation is out there, and it is feeding the stereotypes, isn't it?
The misconceptions are, very pervasive in the country. And it is worrying that it must be so, because we've come a long way. And HIV advancement in terms of technologies and scientific advancement is way, way, way above several other diseases. And in fact, HIV management has become a model for management of many other diseases in the world. And so we shouldn't be here. But here is the case that we are having high levels of stigma that drives people living with HIV underground and prevent them from accessing prevention and treatment services. It's also, even to the extent of people living with HIV, self-stigmatizing themselves and not even disclosing their HIV positive status to even their partner.
Even their partner.
Some of them, sadly, would not even tell and educate their children who were born with HIV and are being made to take medicines every day because they have to, prevent disease progression and ensure longevity. And so if a mother will not disclose to the child that lives with HIV, and the reason why the child should continue to take his or her medicines on daily basis, it becomes worrying. Because
there are risks.
Yes,
there are risks because the child could determine at some point, I don't even know why I'm doing this. I will not do it.
Exactly.
That child starts getting exposed. And then there's the likelihood of infecting other people.
Exactly.
But just back to the point you said about the advancement of HIV, treatment, medication, and all of that. The ARTs, the antiretrovirals. I know that there are systems in place so that sometimes you can even have a woman, a mother-to-be who has it, but through treatment, the child may not be infected, right?
Yes.
All of those are there, but some people feel, once the person has HIV, nothing can be done. Here we can even have a child who is born of a mother with it, but doesn't have it. Just to corroborate what you're saying about the advancement of, technology and others. Yes. in HIV.
So all these add up to the concerns. And it's not as if we are not giving the right information or education. Mothers, when they get pregnant, they are educated about HIV and what they need to do to ensure that their babies, if they have HIV, their babies would be born HIV-free. And we are seeing high numbers of, children under 14 being HIV positive, who are mostly, which largely occurred through mother-to-child transmission. And so we have mothers who know they have HIV, but are not taking the medication, or at some point discontinue. And so it has impact on their children in many ways, including transmission to their babies. And so we are saying that the services are available. What mothers need to do and persons living with HIV need to do is very simple: adherence to treatment. As long as they continue to adhere to treatment, there is a high chance for pregnant women not having HIV-positive children. There are thousands of children who are born to HIV-positive mothers who are HIV-free. And so if it is possible for one person, it must be possible for everyone.
Right.
But the difference is adherence. Because if a pregnant mother is virally suppressed and works so hard or adheres to treatment and maintain the suppressed status, it is highly unlikely that
it will be passed on to the child.
It will be passed on to the unborn child.
And what a great gift that would be.
Yes.
For whatever reason, because sometimes it's through no fault of the person. Maybe something was used here, there, and the person contracted it. But what a gift to give a child, not just life, but the fact that you did everything possible to prevent that child from getting HIV. But that hinges on consistency, taking the drugs at the right time, consistently, and that will bring it. But I have this question for you. There's also this statistic that has been put out that, just an aside, that there are 5 new HIV infections every day in Ghana. Is that correct?
It's rather 50.
50?
Yes.
Yes, because I just did the mathematics, and I realized that when you divide 17,774 by 366, you get around 48 point something.
Yeah.
So it is not 5, it is 50.
It's 50.
We have 50 new infections every day in Ghana.
Yes.
Wow. I was curious about that because I saw 5, but then when I did the math, it wasn't adding up. 17,774 divided by 366. Or maybe if you do 365, then you may get about 50.
If you are doing 365, then it's approximately 50. Now, imagine the mathematics of HIV transmission. If these 17,774 people have multiple partners, which is clearly demonstrated in the Demographic and Health Survey report, that multiple sexual partnership is quite pervasive in the country. And so if 17,000, almost 18,000 people living with, who newly acquired HIV in 2023, and mind you, people who are newly infected are more infectious, you know, so there is high...
Those who are newly infected are more infectious.
More infectious.
What is the science behind that?
The science behind that is that in the acute stage, the virus multiplies, you know,
rapidly?
much more rapidly,
wow.
You know, and so as the virus multiplies much more rapidly in the blood or the tissues, then the person has a very high chance of transmitting the virus to the sexual partner.
And likely at which stage they still don't even know they have it.
Yes, and that is when they don't know. That's when they feel strong and there is no sign of infection. And so they ignorantly transmit the virus. And so if a person has, let's say, 2 or 3 sexual partners, there is high likelihood that at least one of them may get HIV or acquire HIV during the period. And so if you do the multiplication, and their sexual partners also have sexual partners. And so it goes on and on and on.
So one gives it to another, the other person gives it to another person.
Exactly.
So depending on how promiscuous that person is,
yes,
it could be disastrous.
Yes. And this is the picture we all must have in our minds, that having almost 18,000 is not the end of the story. It's the beginning of a much bigger story. And so as a people, we need to realize that we have to do everything to stop the chain of transmission of HIV. Because HIV acquisition or transmission in the country is 80% through sexual contact. And so if we are having high-risk sex, which is casual sex, having sex with your non-regular partner, a non-regular partner, which means having sex with somebody who is not your spouse or whom you are cohabiting with. If you meet somebody on the street, on the bus, at the beach, at the nightclub, football park, and you just have sex with that person, that is casual sex, and it's high risk. And the data shows that in such circumstances, they don't use condoms. And in fact, condoms during high-risk sex is on a declining trajectory since 2018.
Wait, say that again.
2008.
Condom use during what?
High-risk sex is on decline from 2008. It's been consistently on decline.
So I want a proper understanding. What you're saying is high-risk sex is what you've described. Maybe you go for an event, a football match and all of that. You meet this person and then all of a sudden you want to get into that. But they don't use condoms.
No. Using condoms during high-risk sex is very low. They don't use both among males and females since 2008. And what that, unfortunately, high-risk sex activities is rather on the increase among the Ghanaian population.
Is that impacting our numbers?
Oh, yes. So whereas you are seeing increase in high-risk sex, you expect that such sex will be protected. But no, it is rather on decline. Protection is on decline. So the inverse relationship between high-risk sex activities and protection is a major issue for us. Besides, we have multiple sexual partnerships, and which also drives the new infections. And therefore, we all have to take responsibility for our own safety when it comes to HIV acquisition. And no one can do that for us. every individual must take responsibility. HIV is very easy to prevent, very, very easy to prevent, because you don't acquire it unconsciously. You take actions that you deliberately plan to execute.
Unless there's an error somewhere and something is introduced into your body, because it must hit your bloodstream, right?
Exactly. And so if the activities that you deliberately undertake are the ones that lead you to acquiring it, you must as well take deliberate decision to protect yourself.
Precautionary measures.
Exactly.
In other words, you're also saying, I think you've said it, but I want you to re-echo, the main means people are contracting HIV in Ghana, it's not that, oh, I went somewhere and mistakenly this and that. It is through sex, sexual intercourse.
Exactly.
What percentage would you give that?
80%.
80%?
Yes, and 15% through mother-to-child transmission, and 5%, for the other things, like you just said, needle prick or
even sometimes someone who uses certain categories of drugs.
Yes,
and you are sharing
intravenous drug users who share needles and things like that, using contaminated sharps. And so these things are very easy to prevent. You can choose not to use any sharps that have been used by another person. You see, so the point is, preventing HIV infection is one of the easiest things anybody can do. It's just the willingness to take action.
So just mentioning the percentage of those who are transmitting from mother to child, 15% component, it means you are doing something right when it comes to getting mothers to follow the course so that they don't transmit. It means in that sector, there are a lot of gains. Those engaging in risky sex without protection, they are contributing a lot to this. But the mothers, it means you have that practically under control, right?
Yes, we have it under control. First, every pregnant person who goes to the antenatal clinic is offered HIV testing, HIV tests, and they are educated about that. And every mother will want to have a healthy baby. And so they will always cooperate with the midwives and the nurses in the ANC. They take the test, they get to know their HIV status, whether negative or positive. And the nurses and midwives go further if the person has HIV to see how they can also support their families, because it is most likely the spouse or any of the children may have contracted HIV. So there is a way of counseling and helping them also to take the test for them to know their HIV status, so that they will all be supported with treatment if they have HIV, or to reduce their risk in order to prevent HIV infection if they don't have it. So that is available. And then if they have HIV, they will immediately be given antiretroviral treatment and supported to adhere to treatment, become virally suppressed so that they cannot transmit the virus to their babies. But even then, during childbirth, they are supposed to go to the clinic or hospital to deliver, so that their babies can be given medication to prevent acquisition of HIV. That is, if by mistake the virus gets into the baby, then the medication will prevent the virus from attaching itself to the cells and then begin to turn the cells into viral manufacturing factory.
Right.
And so when that is done, the next step is to ensure that the feeding of the baby does not lead.
I was just about to get there.
Does not lead to transmission. And they give them comprehensive education and tools to enable the mothers to feed their babies properly and not transmit the virus to their babies through breast milk. So all these are available to every mother. But because of stigma and the fear of the husband or the spouse deserting her, some of them would not even disclose. And because they are afraid the spouse may find out that they are taking some medicines every day and not knowing why they should do so, they hide the medicines. And some also will not even continue taking the medicine. And this is where we get the mother.
And all this while, if they are not doing the right things, or maybe someday for fear of letting the other person, the partner, see, they don't take their medicines and all of that, they put everybody at risk, because the partner will also be at risk on the back of their failure to take these medications. Probably
the partner even got infected before the wife or the woman got infected. And so there should be no fear in this. You see, this whole business of HIV transmission, the center of that business is the people living with HIV. Because it is those who have HIV who transmit to those who do not have HIV. And so every person living with HIV must accept that, unfortunately, that is the status that they are going to live with for the rest of their lives.
But how can I make the most of the situation?
Exactly. How do you make most of the situation? Especially, how do you ensure that society does not suffer as a result of that? How do you ensure that your family does not suffer as a result of that? How do you ensure that your partner does not suffer as a result of that? And even when you are going to marry, you need to be open,
full disclosure,
and transparent, and disclose to your would-be partner. Usually they have the fear that, when they get to know, maybe they will not accept me. But it's not true. We have so many people who accepted to marry HIV-positive persons, and they are living happily and peacefully. Some of their unions are even far better than non-HIV affected, couples. And so it is just an assumption. If the person loves you and knows your value, that person would understand that HIV is now a chronic disease. You can live with it the rest of your life, and it is not going to affect your life expectancy unless you don't do the right things. And so those who live with HIV must take personal responsibility to protect their partners, their families, their communities, and the entire Ghanaian society.
And on that very point, there's something that I don't know whether not too many couples are doing them now, but you want to get married and all of that, you must check what's the genotype. It's important.
Yes.
The genotype. Does your partner have a sickling, what do you even call it? The sickling cell. There's another term. Those who are not necessarily SS, maybe AS, and they are carriers, right? How could that necessarily? And I even hear now you could be AA, but there are some proteins or something else. So you have to conduct proper tests to know what your AA really means, whether it's a full AA or you have some traits in there, so that if you were to marry someone who was AS or AC or whatever, because these are children, and the children, there are likelihoods, sometimes 50% that they may be. But all of these things, are people checking before they go ahead and settle down with X person or Y person? Like I mentioned, Magic Johnson has lived, we heard, was it not in the 80s that Magic Johnson came up with HIV?
He's one of the...
And look at him, till today, if someone told you he had, you wouldn't believe it.
Yes.
But he has lived his life.
With it for more than 30 years.
Exactly.
And even in Ghana, where HIV treatment started just about 21 years ago, we have people who have lived with HIV for more than 30 years because of treatment. They are on treatment, and because they adhere to treatment, they are still alive, active, and economically productive. And so HIV is no longer
it's not a
death sentence.
It's not a death
sentence. It's a chronic disease. And the technologies have advanced. And therefore, if you are a young person, you need to understand that no matter what your health status must be, there are technologies that are coming up that can even resolve some of the, difficult health conditions like sickle cell. Stem cell technology is making massive change in healthcare. And so these technologies are increasingly becoming available for even HIV treatment. Very soon, we will, in the near future, we expect to have, some treatment that will lead to remission. And people living with HIV may not continue to take drugs every day.
Right.
So these possibilities exist, but we are not there yet. That is why people living with HIV must continue to adhere to treatment on a daily basis.
And speaking of some of the advancements, you just brought to mind, I mean, now there are self-tests.
Yes.
And some of them are not even blood, right? Or
yes.
There are self-tests so that also as a way of stemming the tide of stigma. You can actually purchase, I know you have these available. People
yes.
can purchase these kits
yes.
and test themselves in the sanctity of their own homes.
Exactly.
So that you know it, probably no one out there has to know it. Maybe your family will get to know, but you know how to take care of yourself. Yeah. Can you tell us just a little bit about these self-tests?
Yes, the self-test is non-invasive test, which means you don't have to prick yourself to draw blood to do that. You can do oral swab, with the test kit, and then get to know your status. There is step-by-step.
So oral swab, you're basically using saliva, or is it?
Yes,
or you swab your mouth.
Yes, on the.
Or the mucosal.
Yes, so it's the mucosal. You have to pick the mucosal. What do you call it?
Let's say mucus,
so
right?
Your
mucus. From within your...
what actually happens is that you run it on your gums, both upper and lower gums, and then it will pick the necessary ingredients that are required for the test to be done, and you can do this on your own at home. It is intended to help people who are underserved when it comes to testing. So that, and of course, because of stigma, individuals may be reticent in going to hospital to know their HIV status. But the self-test kits enable people to do this in their privacy, to know whether there is possibility of having it or not. But after they have done the screening, they have to talk to a healthcare professional by going to health facility for further diagnosis and management. If they test positive or if they test negative and they want to confirm, they can go to health facility to get that done.
Okay. And is this easily accessible? Do people have to reach out to the AIDS Commission before they can get it? Is it available in pharmacies? What is it?
Yes.
What's the availability?
If you can get self-test kits from many pharmacies at a cost. But if you go to the health facilities or those that are being distributed in the communities, it's for free. And HIV testing in all health facilities must be free. And so it's available.
All right. I just wanted you to make that crystal clear out there so that everyone knows. AIDS, HIV, getting to AIDS shouldn't be. We all must. I think there's a herd immunity effect on this as well, because the fewer the people getting infected and all of that, and if those who have it are taking their medication, gradually we phase it out. I just also want to say it is criminal if you have it and you knowingly are out there spreading it. It's criminal. And it's inhuman. for you to do that in the first place. But I'm curious. If you look at the new infections in 2023, I'm wondering, why is it that you're looking at 6,457 males, and yet you have almost twice the number, 11,317 females? Is it that the males are not reporting? Is it that the females are reporting more? What is going on?
What it means is that females are more vulnerable to HIV infection than males.
Oh, really?
Yes.
Females are more susceptible to HIV infection than males?
Yes.
What explains that?
Biology, number one.
Biology?
Yes. The anatomy clearly demonstrates that the female genitalia is more of the reproductive system is more of a receptacle. And so when a female has sex with a man, penile sex, and the man ejaculates, the sperm, which might contain HIV particles, may remain in her for quite some time, whereas that of the male, you hardly can see that. And secondly, the surface area of the vagina is much wider than that of the male. And thirdly, the mucous membrane of the vagina is much more fragile than that of male. And especially in Ghana, we have almost universal male circumcision. And circumcision is found to be protective factor for HIV transmission. And so there are a number of reasons for this. And so women must be aware that they are more vulnerable and therefore they should protect themselves.
So in all of this, women should be looking out more. Women should be even more, I mean, everybody.
Yes.
But as a woman, you should be even more particular. I have someone who also operates in the medical space sending me, females have what they call large surface area, as the doctor is explaining. So females are even more susceptible, and they should be even more wary when it comes to this.
Yes.
And that whole bit about if it's not on, it's not in.
Yes.
If the partner is refusing to use protection, you should also refuse to give them whatever it is they're after.
Exactly. And you see, the truth of the matter is that it is much, much easier for a man to transmit the virus to a female than female giving the virus to a man. That,
on the back of the same thing you've spoken of.
That basic understanding should be common among Ghanaians and every people of the world.
So let me just say this, and correct me if I'm wrong. It means that, let's say a man contracts HIV and has sexual interactions with about 10 women. The likelihood that he could infect all 10 women is very high.
It's very high.
But a woman contracts HIV and she may have had 10 male partners. The likelihood that she would infect all 10 of them is pretty low.
Yes. And so, the transmission rate from woman to man is just about 2%. Whereas
2%?
Yes, whereas it is more than 12% for a man.
Transmission rate from woman to man, a woman who has HIV to a man who does not have HIV, is 2%.
Yes.
But the transmission rate in Ghana, from a man who has it to a woman who doesn't have it, is 12%.
Yes, more than 12%. And so you can understand the difference. And that is why women should not gamble with their health and their lives by just accepting that, oh, if he will give me more money to have sex without a condom, it's okay for me. It shouldn't be okay for you, especially when you might have untreated sexually transmitted disease. That can also heighten the chance of you getting HIV.
You know, this also then brings to mind, how do you work with our friends who operate at the red light district? I'm talking about, you know, those who are in the sex business.
Yeah.
You know, I hear there are times where someone would say, oh, I don't want to use protection, and maybe they pay more. That means for men who are engaging the services of such women, the likelihood of spread is right there in that group. Yeah. How are you dealing with that? Do you have any interactions with these people?
Oh, yeah, we have special program for them. And without that, we should be seeing much, much higher new infections in the country every year. But for that group, no matter our financial challenges, we give them special attention. Sex workers, men who have sex with men, now we are adding those who inject drugs, and high-risk men. And so there is special programs designed for them. We provide condoms, we test them, we link them to healthcare facilities for them to receive, you know, further diagnosis and treatment. And most of those who work in that industry, who are reached out by the service providers, actually get the opportunity to receive treatment when they are tested positive. But we must also be aware that HIV prevalence in these groups are much higher than the general population. And so if you choose to have sex with a sex worker, you need to be aware that you are better off protecting yourself.
Right.
Because if you don't do that, you have much higher chance of contracting HIV.
All right.
But so, one point I would like to make is the fact that I have talked about casual sex. I have also talked about multiple sexual partnerships. But unfortunately for us as a country, sex is often transactional. So you may think that some people are doing it openly in a commercial way, but the majority of the people are actually having transactional sex. That means giving out sex in exchange for something.
I've heard of cases where maybe someone's father is in a bad situation, no money for hospital, and someone says, I'll give you the money, but...
Yes. And that happens all the time.
And sometimes they end up infecting
in the workplace, almost everywhere. And that is one major driver of new infections in the country.
Now, we have just a few minutes to go. We're looking at 9% increment in the population of HIV infected between 2013 and 2023. That's a 10-year period. And last year, 12,480 deaths. Are we winning the fight against HIV? I mean, looking at the numbers. Briefly on that, because then I want to get to the bit about the project to end by 2030. I mean, bring it to its barest minimum. And then the bit about the Global Fund and medication. So quickly on the 9% and the deaths.
Well, that is the most sudden aspect of the work we are doing. Knowing that you have the program, the services that people need to end AIDS are available, the policies are in place, the tools to prevent HIV transmission are in place, including technologies. And we are lagging so behind.
In terms of the figures, right?
Yes, on our targets. It's quite disturbing. But the point is that the major factor to that is the fact that we do not have the funds to bring these services to scale. So, for example, we have money from donors to provide treatment to only 125,000 people who live with HIV out of 334,000. So there are 209,000 people who require treatment but may not find treatment because we don't have the money to bring the medicines to cover all of them. And so this is a major problem that we are trying to resolve.
Okay. On the bit about the medications locked up at the port, I did hear that I think in April you got your contingent, but we're being told, I mean, now that we know, the Global Fund has said, until you take care of these ones and probably use them, I don't know what the bit is on that, we are not giving you any more. And this has not happened since 2002, since the program started.
Yeah.
I hear you have enough medication. The last time I spoke to, is it Mr. Otson?
Yeah.
To last you till July.
Yeah.
But if by July you don't get the next consignment, you're going to be in trouble in terms of dealing with HIV and AIDS. Is that correct?
Yeah, it is correct, because the Ministry of Health negotiated with the Global Fund that supplies us the medicines for the 125,000 people I talked about, that they should rather use the money they were going to use to buy the medicines, to rather buy the diagnostics, that is the test kits and the reagents for the labs, whilst government buys the medicines. And the government supply of the medicines are not in yet. The government procured medicines have not been delivered. So until, if they are not delivered before the end of July, we are going to experience stock out. And we expect that government consignment would have to take us through the rest of this year and beyond. And if that doesn't happen, then we are going to face a serious problem.
What would be the impact of such a stock out?
Well, what it will mean is that we will be, let me illustrate it this way.
Briefly.
You know, someone on life support plant, when you take the plant off, that person is going to die. Or somebody on oxygen, when you remove the oxygen, the person is going to die. It's exactly the same way that if you deny the person living with HIV the antiretroviral medicines, then you are asking the person to die. You are literally saying that that person must develop, will have to have disease progression and die of AIDS eventually. That's what it means.
Okay.
Or you are also saying that that person would have to have what? Resistance to the drugs he is used to. And so even if later you bring the same drugs, it may not work.
By that time, resistance has set in.
So, yes, so we need to be aware of the implications. And it means transmission would also increase.
So transmission and death.
And death.
Those will be the consequences.
Exactly.
Just quick answer on this, we have to go. So the goal to tame HIV/AIDS by 2030, how close or how far away are we?
We are very far.
Very far.
Because
on a scale of 1 to 10, how far away are we?
Yes, we have to diagnose 95% of people living with HIV in the country by the end of 2025. As at the end of 2023, we had done only 65%. So we have 30%.
35% to go.
Yeah, we have
65,
done 65. So
35
we have
is left.
30%. 30 percentage point to reach. That's how far we are from our target.
And this is just 2025?
Yes.
And we are in 2024?
By the end of next year, yes.
So would you say it is feasible to get there by 2025?
If we get adequate funding.
You can get there?
We can.
Doc, you are Sembonepo, you are Jumaye. But thank you for the good work you're doing for Mother Ghana, and don't get frustrated. We will also support you in the best of ways.
Thank you very much.
We're grateful. That is the Director General of the Ghana AIDS Commission, Dr. Treme Etiahene, spearheading this effort. And of course, we must all support the effort. Don't you forget, like back then, we had the ABC of all of this. Abstinence, if you will not abstain, be faithful. And if you will not be faithful either, well, condom use is recommended. The ABC.